And you're on.
All right. I'll introduce myself, tell you a little bit about who I am, and so you can, and I would let you know that please feel free to ask any questions as we go through. I think it's easier with this kind of topic to talk about it as I go through because there's so much stuff that by the end you might have forgotten the first question that you had. I'm Dr. Donese Worden. I'm a naturopathic medical doctor. I have 2 practices, one in Scottsdale and one in Mesa, Arizona. I'm also a global educator. I'm all over the world. I'm in Europe a lot because I think when it comes to chronic degenerative diseases, they're far ahead of us. And a lot of their technology and a lot of things that they're doing. So Italian, Russian, and German technology specifically that I brought to the United States, and I've hooked some of those companies up with universities for research to be done in this country off of the research that they've already done in their universities, like the University of Milan has done some fantastic studies with some injectable homeopathics with interleukins and cytokines and things that we'd love to be able to use in this country, but without the side effects. They got them in low dosages, and I won't get too much into that, but some exciting new systems. And I say new systems as in nothing like what we have here. They've done some great research, and some of the departments at ASU are starting to not only accept that research and go beyond that, but do some more exciting things with it. So I love research, and that's why I like your group, because I know you obviously do too. I do preclinical trials out of my clinic. So if somebody has a new nutraceutical or a new something, and we want to see how efficacious is it before they go and try to get an NIH grant or spend hundreds of thousands of dollars on a study, we do small clinical trials there. Does it look efficacious? Is it safe? Have we done that? If it does, then they go on to their bigger trials. So I do research at a smaller basis than probably what you're working with. So that being said, my passion is bioenergetic medicine. I do a lot of things, nutritional IVs, and now resveratrol IVs, which is being studied in cancer, and I'm doing it in my patients because as a naturopath, I'm allowed to inject natural substances, and I am watching it shrink tumors and watching people get much better. So some exciting things in the forefront, but what I love to see and what I love to work with is my topic tonight is bioenergetic medicine, because our bodies are frequency. That's how our cells communicate with themselves to one another. And the more we know about frequency in energy medicine, the more exciting it gets. And I think that in the future, not in the near future, but in the future, we will stop using so much pharmacology, including botanical and pharmaceuticals and all of it, quit dinking around at this biochemical level and start working with the energetic body, because it's very fast in its change and it's profound in what it can do. And I see it every day. I was telling a couple of you before we started tonight, a new technology out of Russia that was developed for their cosmonauts. I'll probably talk about it at the end. I was working on a Parkinson's patient. He came to me in a wheelchair. I had 2 treatments. He was better after his first treatment. Second treatment, he said his pain was better. He was doing better, a little more functional in his hands. He was in a wheelchair, couldn't stand on his own, and today he walked into my clinic. Walked in with a little spry. He had a little bit of the Parkinson's gait, shuffle, but good little fast little gait, and said, my pain's much, much better. And I said, but you're walking. And he said, but my pain's gone. And that's the priority of us, of saying he'd rather be out of pain than walking. So it was fast. That was with 2 treatments, and I see that over and over again with these kinds of modalities. If they're done correctly, the human body's very fast and very smart in changing itself.
What did you use?
Pardon?
What did you use?
SCANAR. It's an acronym. So it's the SCANAR out of Russia. Phenomenal. I've been working with cold lasers for about 15 years in frequency. Love it. Fantastic. But nothing has come to the profound results as quickly and as fast as this Russian technology. So I'm very excited about it. Well, I might as well talk about it. It was at the end. We'll talk about it at the beginning, right? I think it was the last slide. Now it's the beginning. It's an acronym. But with frequency, with cold lasers, the only thing that I was able to change, if you had a particular laser, you could put in a specific frequency. We know the frequency of some tissues in health. Myosin and contraction, EVA muscles at about 16 hertz. Some of those we've identified, and we know in an injured tissue, if it's muscle, if we put in 16 hertz, we see good function. That's why the athletes use it. That's why, stronger, better, faster. However, the only thing that I could change was my dosage, and how close I was, how long the treatment was, and that was anybody's guess how long I should be treating, and the frequency. Still got good results, and I've been teaching cold lasers to physicians for a while. But a year ago, I was lecturing, probably similar to this lecture, in Florida to a group of doctors, and a group out of Australia that had a hold of the Russian technology knew that I was lecturing in Florida. They came down to hear me lecture, and after the lecture they said, "We've got some new technology to tell you about." And I said, well, first of all, does it have any studies? Usually when I say that about this new stuff that everybody shows me every day, they go, well, no, but, and I go, well, come back when you've done a little bit of homework. They told me they had over 780 studies. Only a few hundred had been translated from Russian to Chinese to English. But that piqued my interest, and then when they told me it was developed by for their cosmonauts, their equivalent of their NASA, and it was to diagnose and treat in space. And it was developed for the Mirror program. When that was up, remember, they're going to send up the astronauts and leave them up there for years. They couldn't use pharmacology. It's a closed system. When they had to urinate, they had to filter the water and drink it. So they could not use pharmacology. And they put their best of the best in the room and said, portable, lightweight, small, self-contained, diagnose and treat. That's what this technology is. When Perestroika happened and they had to bring the astronauts down, the technology was almost lost because the military had a hold of it. But the original developers, the scientists, went to the military and said, please let us have this. We've worked too hard. It's too good technology for medicine to let this drop. And the story is, and most of the people that are around the Russians, they're still alive, the developers. The general that was in charge of making that decision had a hand that had been shot. It was non-functional. He said, you get my hand working, you can have it. They got his hand working, and so they got it back. Two factions parted. One wanted to keep it for the motherland and do the studies and not share it with anybody else. And the other half said no, a little more entrepreneurial spirit. They really wanted to share it with the world, and they wanted to see, obviously, if there's a dollar there to make. So the ones that took the technology to be able to allow that, they got it into some European countries. They started doing major studies in their major universities. They have entire hospitals that use this technology that treat cancer, pain management, many things, musculoskeletal, dementia, Alzheimer's. So Australia has done some multi-center trials on dementia and Alzheimer's with this as well, and those studies are looking very, very good as well. We have a couple of trials in the United States being done now. Long story short, they told me about it, and I said, it sounds good. I'm glad there's some research, but I've got to see it work. So I said, send your best down, and I'll give you 10 of my toughest pain patients, and stroke, neuromuscular problems, central canal stenosis, which is a mechanical problem in the back. I thought, what are they going to do with that? And after the first patient, I said, I'm in, I want to learn. So this technology, there are some Chinese knockoffs in the country. I've had experience with those. They do not work as well as the real Russian technology. And the only group that's been designated by the Russians to do the actual training in the right way is that Australian group. And I was the first doctor to be trained by them to bring in the United States with that proper training. And there's 3 levels, and I've been through all 3, and I'm still the only one. But I was in Berkeley 2 weeks ago. We've got some San Francisco doctors.